I'm a consultant physician and diabetologist at Atreum Speciality Hospital in Rajarajeshwari Nagar. Today I'll be talking about cardiovascular diseases. Mainly, what is meant by heart diseases. So, cardiovascular diseases are mainly conditions which affect the heart as well as the vessels of the vessels which supply blood from the heart to the different parts of the body. So, in cardiac conditions, mainly the heart diseases, the most commonly seen conditions are like ischemic heart disease, or also what we call as coronary artery disease, or commonly which we refer to heart attacks. So these are the conditions which are commonly seen in day-to-day practice. We also call it as acute myocardial infarction or heart attacks, and also heart failure, which is also one of the commonest condition which is seen in patients with diabetes, hypertension, and other patients who take alcohol regularly. So heart attacks are mainly caused by what we call as atherosclerosis. Atherosclerosis is a condition where there is formation of plaques in the blood vessels which supply the heart. So when these blood vessels are blocked, they may be blocked partially, they may be blocked completely, and one or more than, there are three main blood vessels which supply the heart, and if one or all the three blood vessels are blocked, so that will lead to heart attack. So it may be sometimes mild heart attacks, which we call, mild when the patient does not develop any hemodynamically significant heart attacks, or the patient survives the heart attack and he will have only mild chest pain and symptoms like sweating and difficulty in breathing, and will be immediately taken to the hospital, or sometimes even the patient may not experience the symptoms of heart attacks, especially in diabetes patients, where they just feel fatigue and they may not have any any symptoms of heart attacks, and sometimes it may go unnoticed. So that is mainly called as mild heart attacks in layman terms. But massive heart attacks are heart attacks which cause severe heart failure, and also which cause severe symptoms, and sometimes it may lead to the death of the patient, which may occur within minutes to seconds. Differentiate between mild heart attacks and severe heart attacks, because timely intervention will prevent the death of the patient, and also sometimes morbidities like heart failure. Okay. So most of these heart attacks can be prevented mainly by there are what we call as risk factors. So there are modifiable risk factors and also which are non-modifiable risk factors. The modifiable risk factors are the risk factors which can be modified or which can be changed by the patient. So modifiable risk factors are mainly like hypertension, diet, then diabetes, and other smoking, alcohol consumption. So all these are risk factors which lead to heart attack, which can be modified. There are what we call as unmodifiable risk factors which cannot be modified. Like for example, the age of the patient. Age of the patient cannot be modified. Then the sex of the patient. So male patients are more prone for heart attacks, and female patients are less prone for heart attacks. But however, nowadays even female patients are developing heart attacks at an earlier age, maybe due to other factors like stress, diet, and lack of exercise. And similarly, the race and some certain genetic makeup of the patient, so which can lead to early heart attacks. So all these things cannot be modified, but there are certain risk factors which can be modified. So the modifiable risk factors are mainly diet of the patient we should always advise the patient to have a proper diet. The patient should avoid excess intake of fat and excess intake of carbohydrates. Patient should regularly exercise, exercise regularly, and should always control their weight, and also regularly exercise at least 45 minutes in a day for at least 5 days in a week. So by exercising, so one thing is we can reduce the weight, we can improve the insulin sensitivity of the body, and also we can condition the heart, and will also improve in the metabolic activity of the patient. And then we can also, there are conditions like hypertension. So hypertension can also be controlled. So one by diet and exercise, and also, by taking less amount of salt and regularly exercising, and also by taking medicines regularly. The patient should always, especially hypertensive patients, should always go to their doctors and get checked up regularly, at least once in a month or once in 2 months at least, and they should take their medications regularly. Most of the patients, so when they get their hypertension controlled, so most of these patients, they stop their medications. So that should not be done, because with the medications the blood pressure will be controlled. Once they stop the medications, the blood pressure will shoot up, although it doesn't shoot up immediately. So it will take some time, maybe like 5 days to 10 days sometimes, and it may suddenly shoot up, and this will lead to multiple problems like sudden heart attacks, heart failures. It can also lead to kidney disease. It can also lead to hemorrhage in the brain, what we call as stroke, hemorrhagic strokes. So all this can happen if the BP is not kept under control. And my most important thing is to control the diabetes. Okay, so nowadays diabetes is one of the most major disease, non-communicable disease in the patient. So, and India is called as the diabetic capital of the world. And most of these diabetics are now middle-aged to young age, so mainly between 30 to 60 years. So, and if the diabetes is not controlled properly, so all these patients are going to develop complications in the future in the form of like early heart attacks, strokes. They are going to lose their eyes. They are going to develop retinopathy, which will lead to loss of vision, and also they are going to develop nephropathy. That means it's going to affect the kidneys. So, and whenever these patients develop this kidney disease or retinopathies, they are at risk for developing even cardiovascular diseases like heart attacks and heart failure. So, controlling diabetes is very, very important. So, diabetes can be controlled one with the diet, as I mentioned earlier. So, diet and exercise. So, they should avoid taking a lot of carbohydrates. The protein intake should be optimal, and also the fat intake should be minimal. And the patient should regularly exercise, at least, as I told, 45 minutes in a day, at least for 5 days in a week. And also the patient should have good sleep, and also try to do certain exercise, this thing to reduce the stress. They can go for yoga, they can go for hobbies like swimming, playing cricket, football, whatever they like. So regular exercising and regular spending their times on hobbies is very, very important, so that they will be happy and they do regular relaxation exercises, and also they reduce their stress. So this will help in controlling the diabetes. And also these patients should always take their medications regularly. That is also very, very important. If they don't take their medications, the blood sugars are going to rise, and if the blood sugar continues in the higher levels for a lot of period of time, so these patients are going to develop heart conditions, heart diseases like myocardial infarction, coronary artery disease, which will lead to myocardial infarction, later ischemic heart disease and heart failure. And one more important thing in diabetic patients is they most of the times they don't develop the symptoms of heart disease, especially heart attacks. So most of the patients, they complain of, in normal patients, they complain of chest pain, breathlessness, and sweating, vomiting, all these symptoms. But in diabetic patients, usually they don't complain of any pain. Usually there won't be any sympathetic symptoms like sweating, vomiting, all these things. So these patients generally complain of only fatigueness, or easy fatigability, weakness, or sometimes breathlessness. So these are called as angina equivalents, and we should always suspect sometimes heart attacks in these patients, and wherever possible the ECG should be done, and the patient should be immediately referred to a cardiac center or to a physician immediately. Timely intervention is very, very important, because if the condition is ignored, so you may lose the patient in minutes to hours. So timely intervention is very, very important in patients with ischemic heart disease and myocardial infarction, what we call as heart attacks. Okay, and also there are other modifiable risk factors like smoking. So nowadays we are seeing like even in patients that young people they smoke a lot, and smoking is one of the very, very major risk factor for heart attacks. Not only for heart attacks, also for other conditions like cancers and heart failure and even certain type of gastrointestinal diseases. So these patients should always avoid smoking. Avoid or complete cessation of smoking is very, very important, especially if they have symptoms suggestive of any heart attacks like anginal pain, like pain while walking, pain while running or climbing the steps. So what we call as anginal pain, that means there is decreased blood supply to the heart, and whenever there is increased load on the heart, these patients are going to develop symptoms like chest pain. So these patients should be evaluated for blocks in the heart. We can do ECG treadmill test, or we can also do what we call a CT angiogram and find out if there is any blocks in the arteries supplying to the heart. So if there are such conditions, so they should stop the smoking immediately. If they are consuming alcohol, so regular intake of alcohol should be, it should be reduced to maybe like 60 to 90 ml of alcohol every day. So it should not be more than that. And these patients should be told to modify their diet and other risk factors, especially stress and smoking. So these lifestyle modifications will go a long way in improving the condition of their heart, and also will prevent these patients going into heart failure. And also many patients will develop what we call as heart failure. Heart failure is a condition where the patient, the heart is not able to supply the blood to the different parts of the body according, to the requirement of the body. That means the amount of blood which is pumped from the heart is very less, or even if it is pumped at normal this thing, so the amount of blood which is pumped is not enough to cope to the demand of the body. So this we call it as like heart failure with reduced ejection fraction, or heart failure with preserved ejection fraction. So heart failure is a terminal condition in patients with ischemic heart disease or hypertension or other conditions like valvular heart disease, congenital heart disease, which affect the heart, whether its structure, its valves, or the blood supply supplying to the heart. So all these will lead to what we call as heart failure. And heart failure is a terminal condition, and if not, if the condition is not recognized at the earliest, and if it's not treated properly, so the patients will develop severe heart failure, and their life expectancy, what we call as 5-year life expectancy, will be reduced drastically, and most of these patients will die at an early age. So there are many interventions now available. So it may be pharmacological interventions, or it can be devices which we use to improve the heart failure. So all these can be done if the patient is recognized at an earlier stage, and we know the cause for the heart failure, underlying cause for the heart failure. There are so many conditions which can lead to heart failure, like as I told you earlier, it can be hypertension, it can be diabetes, it can be ischemic heart disease, it can be excessive intake of alcohol, what we call as alcoholic cardiomyopathies. It can be certain congenital heart conditions, or it can be valvular heart disease. The most common being rheumatic heart disease in India, and it can also be due to conditions called as cardiomyopathy, where we don't know the exact exact cause for these conditions, but they lead to changes in the structure of the heart, and will lead to heart failure eventually. So all these conditions should be recognized at the earlier stage, and if they are recognized earlier, and if we treat them at the earliest, so we can prevent the patient going into heart failure, and even if the patient develops heart failure, if we recognize at the earlier stage, we can improve their life expectancy and also improve their quality of life. If there are any questions, or if you need any consultation regarding this, you can contact me at Atreum Speciality Hospital. I will be available in Atreum Speciality Hospital every day from Monday to Saturday from 6:30 to 8:30 p.m. Thank you very much for your patient listening.